Almost 10% of adults in the United States suffer from some type of depression each year. Because depression is so common and creates so much suffering, I want to provide you more information about the signs and symptoms of depression and what types of treatments are available. Someone with major depressive disorder must have at least 5 of 9 of the following symptoms nearly every day. These symptoms include sad mood, decreased interest and pleasure in things, change in weight either up or down, an increase or decrease in appetite, an increase or decrease in sleep, either slowed activity or an increase in restlessness, feeling more tired than usual, and a decrease in energy, having feelings of worthlessness or guilt, decreased concentration, and thoughts of no longer wanting to live. These thoughts, feelings, and symptoms can be very frightening and may feel unusual. Unfortunately, many people experience these symptoms. Know that you or your loved one are not alone, but these thoughts and feelings do need to be addressed. Some people may experience typical symptoms of depression, such as the ones mentioned, or they may have manic symptoms that may indicate bipolar disorder. These symptoms can be differentiated by a mental health professional. So it is very important to be open and honest about your symptoms. The more your mental health professional knows about you and your symptoms, the more he, she, or they can help. Mania is described as an episode of abnormally elevated or irritable mood that must last at least 7 consecutive days. The mood must have at least 3 of the following symptoms, such as increased self-esteem, decreased need for sleep, rapid speech, quick moving thoughts from one idea to another, being easily distracted, having a sudden increase in goals and activities, physical restlessness, or an increase in risky or dangerous behavior. These symptoms can overlap with other disorders, including anxiety and attention deficit hyperactivity disorder. Mania also may fluctuate with major depressive symptoms. So once again, it is important for your mental health professional to know what you are experiencing so he, she, or they are able to determine an accurate diagnosis. It is also important to know that sometimes severe depression can be associated with hallucinations such as hearing voices outside of your head, episodes of suspiciousness of others. Bipolar depression can include these symptoms as well. Medication treatment for bipolar disorder is often different than traditional depression. A person with bipolar disorder may receive treatment with medications referred to as mood stabilizers or antipsychotic medications, even if there are not necessarily any displayed psychotic symptoms such as hallucinations or delusions. Postpartum depression can also be very severe. It can include difficulty with bonding with a newborn and possibly thoughts to harm self or others. Postpartum depression can also include hallucinations and paranoia. Sometimes hospitalization may be required for safety and stabilization for those with severe depression. There are many different types of antidepressant medications. Antidepressant medications work on chemicals in our brain known as neurotransmitters, which can include serotonin, norepinephrine, and dopamine. So when a person suffers from depression over a period of time, at least one of these chemicals may become depleted in the brain. Antidepressant medications help your body to replenish its own neurotransmitters so that the person can naturally feel better again. It typically takes the brain about 9 to 12 months on the medications to replenish these chemicals. Therefore, during a depressive episode, most people require medication treatment for this period of time. However, if some people have experienced multiple episodes of depression in their lives, these people may choose to stay on antidepressant medication for an extended period of time to prevent any reoccurrence of their symptoms. Most side effects of these medications can be very manageable, and some are very temporary, especially when first initiating a medication. Antidepressant medications are not habit-forming or addictive. Medications have to be studied in clinical trials for many years before they are proven to be safe and effective by the FDA, the Food and Drug Administration. Everybody's body chemistry is different, so one medication can be very helpful for one person and not necessarily helpful for another. It is not unusual for people to sometimes need to try more than one medication before they find what's best for him or her. Sometimes the medication has to be changed over time. There are other types of treatments that may be helpful in addition to or in place of medication treatments. These include electroconvulsive therapy, known as ECT, transcranial magnetic stimulation, known as TMS therapy, light therapy, alpha stimulation, biofeedback, eye movement desensitization and reprocessing, known as EMDR, as well as hypnosis. I will discuss some of these treatments in detail in the future. Statistics show that the best outcomes of treatment of depression are the combination of both medication treatment and talk therapy. It is important to take your symptoms of depression very seriously and address promptly with a mental health professional. If there are any concerns about your safety or the safety of others, this is an emergency. In the event of an emergency, if in the United States, immediately call 911 or go to your nearest emergency department or crisis center in your county. Please never hesitate to ask for help. Depression needs to be more understood because unfortunately, there is still stigma surrounding these types of symptoms. As I have mentioned before, I believe the treatment of depression and other mental health disorders is just as important as any physical condition, such as hypertension, diabetes, or heart disease. The symptoms can be just as serious and can negatively impact the quality of life. I hope this presentation has provided you more information about the signs and symptoms of depression, as well as a variety of treatments that are available. If you would like more information on these topics, please consider liking this video and subscribing to my channel. Thank you for watching. Take care.